they told him, your legs must be amputated. We don't give up. More than about 50 procedures, and you must have plan B, plan C, and even plan D. But the final result was the patient standing on his legs.
What makes vascular surgery a special field in healthcare?
Very good question. Also, vascular surgery actually is very wide specialty because we are interfering with every other specialties. As we all know, we have vessels overall in our body, and where we have vessels, we are active there. That means vascular surgery can deal with everything, everywhere in our body. For sure, there is some special treatment which we are concentrating on, but usually we are the specialty which is going everywhere and dealing with all other specialties.
Doctor, what are the main challenges that you're facing as a vascular surgeon?
We can talk about small challenges, which is our daily practice. Every patient is challenged because we are targeting to get the best results. The big challenges in vascular surgery are usually two things: life-saving, limb-saving. That means we have patients we are struggling to save their lives. We have on the other side some patients who are struggling to save their limbs.
Doctor, can you tell us some patient stories where you had to confront these challenges?
Yes, for sure, they are not rare. We are receiving always patients with either life-saving or limb-saving conditions. I can tell you about one patient. He came to us and he was already in another facility, and they told him, okay, your legs must be amputated. So amputation is for the patient is shock always. As a vascular surgeon, what makes us special? We are struggling and fighting until the end with the patient. As consultant vascular surgeon, we are not just working with wounds, patient, gangrene. We take the patient as full concept. That means this patient will come to you with either life-saving condition or limb-saving condition. And the challenge, you must deal with all of these things. You are not dealing with wounds. You are not dealing just with disease. You are dealing with whole patient. And this will affect the end result usually, because if the patient is upsetted, if you do everything, the result will not be okay, because the patient immune system responding not just for your treatment to the patient himself. And that is the challenge usually. The second challenge, as we accepted such patients, first of all, we must check always, are they diagnosed correctly? We go from the beginning always and we check. We are talking about, we discovered there's something with the immune disease and was not diagnosed. For sure, we know all diabetes is one of the causes of such things. And first is the concept, how to diagnose the patient. First step is correct diagnosis. If you have correct diagnosis, you have correct policy. The second thing, always we need each other. We need the patient as part of the team. We need other doctors. That means I need the intensive care doctor, I need the radiologist, I need all of them, because nowadays the patient is complex and you must deal with it, and you don't deal with one aspect and ignore the other. With this patient, directly as we admitted him, we have multi-speciality committee and we make our concept for treatment. For sure, the vascular surgeon, he is the main one, because we are dealing with the patient, we must make the surgeries, but you can't work alone. That is the concept what we are always working on in Medcare Hospital Al Safa. We are a team, not vascular surgeon alone and even not other specialty. We struggled with this patient, really long journey, more than about, I think, 50 procedures. Wound cleaning, wound debridement, skin grafting, and we struggled at the same time with his other diseases which causes this problem, autoimmune disease, diabetes, and everything. And we were able to change the concept from amputation to the patient, and at the end we win this struggle and the patient stand and he is able to walk. And this is for us the moment I can't describe it at all. Even myself, I feel something which I can't describe. As we said, it is the concept. It is, you are ready to struggle with the patient. You must understand your patient, and you must take the patient as the whole concept, and you must always thinking I'm not the one who is doing everything. We are team.
Can you tell us about the arts of vascular surgery in the amputation case?
When we are struggling to save limbs, we have standard plans of care. It will be modified from one to other patient, but initially, as we received such patient, as known in common, they have gangrene, they have infection, they have exposed bones, they have exposed muscles, and the challenge is always first step, correct diagnosis, as we said. Second step, infection control. We have infection, we can give medication, but we must clean all areas. We must check if there is any spaces where the infection not to reach. And as long as we control the infection, the next step always will be the revascularization, we named it. That means we will check, is the blood reaching these areas? Because if you need new tissue, you need blood. And with revascularization, that means we check how is the blood supply of these areas, and we provide, if the patient need any procedures for such patients, we are doing catheter, opening vessels to reach the blood in these areas to promote the healing. And then it will come the complex wound care, which very advanced techniques. There is negative pressure dressing we applied for such patients. There is artificial skin. You must protect the surfaces until you will get the healing from the patient himself. And it is not always successful. And if the areas are very wide, like our patients, we must go for very complex transferring of skin from other areas. For our patients, we take from everywhere, from thighs, from upper body, from the shoulder. Sometimes we take muscles. If we have exposed bone, so just skin alone will not be enough. It's very complex, staged procedures. That means we are going every 2-3 days, in the operation theater, sometimes cleaning, sometimes making complex dressing, sometimes covering some areas, until we reach the final result and the patient will be able also to walk at the end. This patient, our mission will be end when we cover everything and the patient's able to stand on his both legs. And then he has another journey, as we said, it's teamwork. He has a rehabilitation journey, because after all of these procedures, the muscle will be weak and he need rehabilitation.
How long is the healing time for this case?
We are talking about almost 6 months of surgeries, intensive care unit, medications, physiotherapy the whole time. And as we said, it's not big deals to spend long time, but at the end we have patient, he is able to walk instead in patient in wheelchair.
Doctor, where does your mind travel to when you are in operation?
Very good question. For us as surgeon, the operation theater, the operation room is different world, and most of us are different. Really, if you see the surgeon outside and inside the operation room is different person. We are always really concentrating. Sometimes you don't hear what's going around. You are in your, all ideas are in the patient. You are thinking always what is the best solution. In the vascular surgery, we have two things. You must be clean and quick, because time is very important for us, and the vessels, you can't take long time to prepare the vessels. And that's why we are always trying to finalize our surgeries as soon as possible, but as clean as possible. In all surgery specialties, but especially in vascular surgery, you will never be good surgeon if you go in the operation room with one plan. That means it's not rare that we are going to do something, but after exposure of the vessels, we find, okay, our plan is not the best. And you must have always, before going to the surgery, plan B, plan C, and even plan D sometimes. And for all of these plans, you must be prepared yourself and your equipment. And that's what makes vascular surgery is a bit different from other surgical specialties. Because when we are going to remove gallbladder, it will be gallbladder. Appendectomy, hernia, it's surgeries, need complex procedures. But in vascular surgery, sometimes you are going to open one occluded vessel, but the catheter will not go through. It means I'm not able to go through this occlusion, then I must have plan B, direct technically and equipment must be ready for plan B, which is maybe bypass, open surgery, and the patient must be prepared for such things, and even the team. And that makes the vascular surgery, even for our team, a little bit more stress, because it's not always straightforward. You will go for one procedure, you will end with another.
How many plans did you have to set for this amputation case?
For our patient amputation case, we are jumping always from one to other plan. It's different scenario because you are opening the wounds today. You decide, okay, I will go for this procedure. After 3 days, you open the wound. Maybe you get small infections there, or your graft is not working well, and then you must change your policy. That means you can't say, okay, patient's admitted, my plan is tomorrow to clean the wound, after tomorrow to make graft. You must be really very flexible with your plan, and every day you may change your plan. For example, today everything is okay, and we are going to make graft next dressing, that after 3 days. But after 3 days you have infection, you will not be able to do anything. That means every day you have plan, every day you will get new concept for the patient. For patient, as we said, with long, difficult, complex cases, your plan is very flexible, and from day to day you must change your plan depend on the patient condition. That's make really vascular surgery very challenging.